So this is an interesting question, and the question is based on why do we lose our hair? Why does our hair turn gray? What's happening to my hair? Why do we care so much about our hair? So hair, much like skin, is a sign of your vitality, your life, your youth. And for a lot of us, when we see our hair thinning, when we see signs of baldness, and this happens both in men and women, it can be very disturbing. For a lot of men, this is that sign that, hey, guess what? I'm getting older. I'm not as vital as I used to be. And for some women, it can be a sign that, hey, guess what? I'm not supposed to lose my hair, even though many women do lose some of their hair and have a different pattern of hair loss than men. The question on this is what happens, what are the factors here? So if you had to divide and say, what can I do to kind of improve my chances and do everything I can from a personal stance to improve my chances of losing hair, the first thing is going to be dealing with your stress. Stress can lose hair. Stress is proven to make hair turn gray, and you want to try to eliminate stress as much as you can in your life. And that's easier said than done. There's some factors that you can do that includes meditation, walks, learning to cope with stress. All of us are going to deal with stress in some level. And so stress is going to be important for men and women for hair loss. The second factor you're going to look at is kind of trying to improve your aging and how you're aging. A lot of our hair is pre-programmed to die. And this goes through this phase of senescence, which happens when our hairs and other cells, eventually at some point, our body says they're no longer needed, and they're going to go through a pre-programmed cycle to either first turn gray, white, then die. And that's part of almost how all our cells can be treated. So if you want to prolong this process, you're going to want to do things on multiple levels, and that takes way too long for me to talk about all those factors, but that includes trying to delay your aging process, improve your aging process, and this is things like having healthy habits and exercising and taking the right supplements and getting enough sleep. And again, all these things to do that. And you can track your aging process. You can visually show your aging, and that's another way of improving it. And then the final way of improving your hair loss is just going to be understanding how your hormones work and effectively treating them. For men, it tends to be a little bit of a simpler process. Men are going to have, at least some of us are going to have the DHT, which can miniaturize your hair at different levels. Our hairs are programmed to basically miniaturize at different levels depending on what our genetic profile looks like. And so if you can sort of put up a barrier, I consider this almost like a seawall, and that can be either Propecia or saw palmetto or a combination of both. You can try to prevent this from causing you to have hair loss. Sometimes you get some reversal, but really I think in this case, it's preventative. For women, it's going to be a little bit more complex. Some women will have some elements of male pattern hair loss, and some women may have other aspects of it, and really finding out about your hormonal profile is going to be helpful to find out what are we looking at. There's other factors for hair loss, nutritional deficiencies, immunologic conditions, and these affect patients as well, but I think for most patients, they're going to be in category 1, 2, or 3, which is going to be aging, hormonal, and stress.